been the impact of the EU's Tobacco Products Directive on e-cigarettes?
So I think it's gone one of two ways depending on where you are in Europe. So when the Tobacco Products Directive came in, some countries had almost no regulation. So they had very liberal regimes, the products were available, they didn't necessarily come in particular container sizes for the e-liquids, or didn't have a framework. So the introduction of the TPD there, for example, in countries like Cyprus, let's use them for an example, has actually introduced significant additional restrictions in terms of regulatory framework. In terms of other countries, like Sweden, for example, who didn't permit the products to any extent, by introducing the TPD, they've actually made the products more available within a regulatory framework. So there's actually a lot of variability. The other thing is implementation varies. But I think there was a lot of fear about the TPD. Some people said it might even kill the e-cigarette market. That has not happened. And even some of the elements that we thought were slightly random or not supported by evidence, for example, the restriction on nicotine content in e-liquids, doesn't look to have been a disaster because the devices have evolved. So it's watched this space, but it's been an interesting process of implementation.
You looked at, in your presentation at the example of New Zealand and how they did a volte-face in effect. How did that come about?
So New Zealand had a very restrictive negative policy on e-cigarettes that they're just emerging out of. So officially nicotine-containing e-cigarettes were not permitted for sale in New Zealand. So they've now consulted on a new policy, which is a pro-harm reduction policy, legalising the products, allowing them to be manufactured and sold in New Zealand, but with some protections. For example, age restrictions on sale, they're going to restrict advertising, and they'll have safety standards. So I think it came about for a few reasons. They were following the evidence from overseas, including the UK, and seeing that it could work with a pro-harm reduction framework. There were vapers in New Zealand, so civil society, members of the public who were advocates for changing the policy. And then there were some really influential researchers who'd done good quality trials and other studies, and including one of them who actually works part-time within the Ministry of Health. And then, of course, I'm sure the politicians had a role to play as well in showing leadership.
You mentioned the example of the UK. Some people are holding the UK up as best practice. You're based in Scotland. Do we have an even picture across the UK?
I wish we had more of an even picture, but we don't. I mean, you may know that Wales was considering banning e-cigarettes in public places. That's not gone ahead. Scotland has been more cautious in some ways. We now, I think, have a consensus statement, which is very positive, saying e-cigarettes are definitely less harmful than smoking from the evidence we have. So we've made progress. But there is variability. And I suppose an issue to flag up is what's happening in the prison system, for example. So in England and Wales, a number of prisons have already gone smoke-free, and some of them have allowed e-cigarettes to be sold in prison shops. Scotland, we don't have smoke-free prisons yet, but our government has committed to introducing them next year, towards the end of next year. And in the lead-in time, we're now discussing, do e-cigarettes have a place in that policy? And I think now they will. We had some real concerns from some stakeholders in the process saying, oh no, we mustn't allow them. But I think that's changed. So when we move to smoke-free prisons in Scotland, I think e-cigarettes should be provided and be able to be sold in those facilities so that people who are experiencing nicotine withdrawal and can't smoke anymore have an alternative that's more appealing to them than, for example, nicotine replacement therapy.
A lot of e-cigarettes are actually made by tobacco producers, your traditional enemy. Do you feel conflict in recommending a product that is a manufacturer that also makes this cigarette that you are so against?
Well, it's difficult to say recommend because, of course, they're not medicines, so even physicians can't recommend them. But in terms of supporting the use of e-cigarettes, which our research suggests we should, I think the tobacco industry's role in it is complicated. If we have to point to particular products, we try and point to those made by the independent sector. And certainly in the research I do with Cancer Research UK, as part of a study, we won't fund e-cigarettes made by the tobacco industry for use in a study. So there definitely are restrictions. On the other hand, the tobacco industry have big labs, a lot of resources, and in many ways they've been pushing some of the innovation potentially in relation to these devices. So complex picture, but I think the crucial thing is to keep focused on the evidence, what we know and what we don't know, and be open-minded about where we're going in the future.